So what are other great referral sources to market to? Assisted living communities. So this is separate from your nursing homes and your rehab facilities. Assisted living communities are, if you're not as familiar, they're typically apartment and condo complexes, but yet seniors will pay for their place, plus will pay extra for activities and for meal plans as well. And most typically, these assisted living communities are for seniors only. So you have to be of a certain age, of a certain income to be able to live in places like this. So it's another great source to be able to get potential referrals. Your retirement communities, these are possibly either a housing complex, gated community that only accepts 55 plus and older, can also be condos or even townhomes, but either or, they're retirement communities. So you already have the 55 and plus people living here. Now, are you targeting the 55 plus? No, but guaranteed if you work with these 55 plus people, they have their parents who are 75, who are 70 years old, who are 80, 85, 90, who definitely will be a potential source as a patient. Chronic disease associations. These are your like Alzheimer associations, your variety of different associations. Are you joining these groups? Are you participating in the events that they actually have? You need to look into that definitely, okay? Now, homeowners associations. This can go pretty much with those retirement communities. So by you going to the homeowner association, sometimes they are actually releasing newsletters that you can possibly advertise to, or at the same time as you let them know who you are and what you do and what services you have, so that in case they find out a particular homeowner in their association may need some help, that they can actually reach out to you. Real estate agents. Look, what real estate agents do is they help people find a great home, but for them to sell the home, they tell them how great the schools are, the services in the area, in the community. So let's say, for example, they have a patient or a potential client that they're selling a house to who has parents that are frail. They may want to refer to you and say, hey, if you have any problems, give them a call. These are good ways to be able to network around. Beauty salons and nail tech places. Old ladies love to get their perms. They love to get their nails done. So you also want to market to these areas as well. Family therapists are also a great source to look into. So what I'm trying to teach you guys is you do not need to just advertise just directly or market directly towards just the nursing homes, just the hospitals, just the physicians. You want to increase your potential referrals because anybody is a potential referral source. And once again, remember I asked you guys the questions of what problems can you solve for them? How can you help them? So by looking at these companies, what can you do for them that you can help? Those are the questions you need to be able to ask yourself about that. So, trust officers. Trust officers are a diamond mine when you get in with them. Okay? Now, with trust officers, it can be a little tough to be able to get into them directly. Okay? But if you are able to create a long-term relationship, then typically they will be able to keep you around in their trusted circle. What trust officers do are they provide care management for geriatric clients. So what ends up happening is to be able to get into them, what you can do is you should be able to reach out for trust officers and educate them on what home health and what home care does. Educate them on, risking the risk if you hire privately. And what happens is because a trust officer is in charge of a particular patient, what happens is they want to be able to kind of limit the expense by not paying a lot for services for patients. And so you want to educate to them, especially for non-medical, that if they hire private people to work for the clients and they are not licensed, they're not bonded, then if that person risks and happens to fall or have an accident, that their client, the patient, the geriatric patient, may be liable on paying for those problems that occur, for the injuries, for the care, for their caregiver from being injured while in the job. So you want to be able to teach them the variety of different ways, and there's so many more. But trust officers are always good to be able to be looked into. So here's a quick sales tip. This is what we call the referral source or the referral close, and I've shared this with you several times already. When you get a new referral source, always ask for a referral. They will either say yes or no that they have one. And always do this in the beginning of a presentation. You don't build a business, you build people. And then people build a business. Zig Ziglar said that. And it's a very good quote. So for you to be able to build your business, you need to build people. Okay, estate and trust attorneys. So estate and trust attorneys usually understand the need for a care agency for the client. They know that their client will need care. Because for them to remain as the estate and trust attorney for the client, they need to make sure these patients live longer. So they know that the need of the patient having care, to get care now than later, is vital for them to survive. Now, the typical patients that you're going to be dealing with these particular, who has estate and trust attorneys, are clients that are well-to-do, that are rich, that have money. So these are great sources for your private duty clients. They're going to, price is not really much of a myth. It's not much of a problem for them. It's the service that they get is what's important. So when you're dealing with them, you want to be able to understand that the potential clients that you're going to get are long-term clients. So you want to have these patients. You're going to want to have these clients. And most of the time is when they have an estate and trust attorney, the main contact is not family members. It's the trust attorney. It's the estate attorney. And also look into this. These attorneys also needs to find their own clients or new clients. So if you can actually help them figure a way to be able to do cross-branding, cross-advertising to help each other get new clients, then there's going to be able to be a trust and a relationship that's going to be built between both you and their company. So how do you get to them? Find out when the special group meets and see if you can make a presentation about what is home health, who pays, risk of hiring privately, talk about the anti-kickback laws, how your company can help with dementia and Alzheimer's. Because typically their patients more likely are at risk for dementia, are at risk for Alzheimer's. So this gives you an opportunity to be able to provide educational-based marketing. You don't have to just present in front of them. There's a variety of different ways to deliver your presentation, whether it's going to be by educational-based printed materials. You have some videos online. You have some information on your website. But at the times, it's always important to do a live meeting with them because it becomes more personal and they can actually gauge you if you would be a great person to actually be referring patients to. You also have appointed guardians, typically not attorneys, but attorneys and estate trust officers can become also the appointed guardians. Usually, like I said, they're attorneys, but at the same time as sometimes it's not. Great place to find them is guardianship.org. It's a great website. What you want to do is go into this particular website, look up all the certified guardians in your area, and once you have those information, you want to be able to reach out to them so that they know who you are. And these are great referral sources if you're able to get in. So it just gives you the opportunity. And you have to understand this. If you are a current home health agency Let me ask this question. Have you ever marketed to these organizations or these type of people in these organizations? I can literally honestly say that about 1 out of 100 home health agencies have. The rest haven't. So imagine if you have only 700 home health agencies that you're competing against. That means only maybe 7 of them followed up and actually marketed to these companies. But the question is, do they do a good job on following up continuously? No. So understand that it's also a good thing to also advertise and market to these type of people. You have your elder law attorneys. So if you go to example naela.org, you also are going to be able to find out when they have local meeting chapters. Also, go ahead and make sure that you can also reach out to them, because you can also get a list of, elder law attorneys in your area. Once again, remember, they need clients also, so help them. Maybe you guys can do a joint seminar, a joint presentation where both of you can access your own clients, your own network, to bring people together for an event to do a presentation so that you can benefit from each other. We talked about those assisted living and retirement communities. It's really important to establish rapport with the administrative staff. Offer to do a town meeting or other kinds of activities. Consistently visit and participate in activities is very much essential for you. Make a proposal to do a menu of your services. It's always good to make sure that you have a menu of your services. Whether you just provide the medical or you provide private duty. Just giving them a basic brochure about your company is not enough. You need to be able to learn how to differentiate your company. What do you guys provide? What makes you guys unique? Do you guys have pet therapy? Do you have, video conferencing? Do you actually offer telehealth? What services do you have that makes you stand out from the rest? You have your long-term care insurance agencies, right? So naifa.org asked to be a speaker if they're having any events. Very interested in CEUs. A lot of these guys need CEUs, so if you can actually create an event to bring them in to attend that, give them free CEUs, so find out organizations that give CEUs to these type of agents. So you want to be able to be that networker that brings people together. And guaranteed, most of these type of agents sometimes are not familiar with the difference between, skilled home health and non-medical private duty home care. So your job is to provide education to help them and for them to learn what the differences are. And there is actually a one sheet of paper that you can create that's going to describe. You're going to have 2 graphs, for example. You can put one here, the non-medical, and the other side you have medical. And go ahead and put the differences, like a checkbox, where you can actually show the difference of what makes each particular area different. But make sure anything that you give handouts, anything that you create, such as handouts, when you give those out to people, you want to make sure that you always brand it with your email, brand it with your phone number, your website especially, and of course, make sure that you have your company's logo, the name. All the information is very vital when you're creating products. Don't just make a product and not put your logo in it. Branding is very important.